Hi, I'm Tiffany Sharifi, and I'm a licensed professional counselor and certified sex therapist, and I specialize in helping breast cancer survivors navigate intimacy, body image, and emotional recovery after treatment. Today, I want to talk with you about something that comes up for so many people that have been diagnosed with cancer, and that's scan anxiety. So, scan related anxiety, we know from research that it encompasses fears pertaining to discomfort associated with going in for the scan, what the procedure is going to be like, just the feelings of overwhelm and discomfort that come along with that. And then also fear of cancer progression, and then just generally fear of the unknown. Research shows that up to about 81% of adults diagnosed with cancer experience scan anxiety. And so if you've ever found yourself feeling anxious or panicked before your scan or follow-up screening, please know that this is very common and what you're feeling does make sense. Even long after treatment ends, the emotional impact of cancer can show up in very intense and unexpected ways. If any of that sounds familiar, I've got 3 tools to help you feel more grounded and more steady as you get ready to go into these scans. So, tool number 1 is to anchor yourself in what's real and true. When that anxiety hits, your brain may jump to the worst case scenario. So instead of trying to suppress what you're feeling, because again, your feelings are very valid and quite normal, you want to acknowledge and validate, I'm anxious about my scan. I'm feeling overwhelmed about going in for this appointment. So even saying those things and acknowledging them can help you process and regulate your emotions more. Instead of jumping to the worst case scenario, you want to remind yourself that today what I know is that I am safe. My last scan was clear. I have a trusted medical team. I've done hard things before and I can do this. And so those are just some examples. Also, you can write them down or screenshot them on your phone so you can have those things close. So when that anxiety hits or you notice your mind is jumping to the worst case scenario, you can come back to what you know to be real and true in the moment. Normalizing your feelings can go a long way for helping you to regulate and not go into worst case scenarios. So you want to avoid suppressing and acknowledging this is really hard. I am feeling scared. Those things are okay to say. Tip number 2, I want you to use your 5 senses to ground. This is called the 5-4-3-2-1 mindfulness technique. The way that you do this is you identify 5 things that you see. So if you're outside, you may see the grass or the house across the street, just anything that you can see that's in your view. I want you to focus and identify those things. So identify 5 things you can see, 4 things you can hear. So you may hear a car door slamming or a dog barking. 3 things you can feel. You may feel the chair on your back, the clothes on your body, things like that. 2 things you can smell. You may smell a candle burning, your soap that you use that morning. 1 thing you can taste. And an example of that could be like mint gum or coffee. So tapping into your 5 senses can help you calm your nervous system, slow your heart rate, bring you back to the present moment instead of predicting future scenarios that makes your anxiety spiral. Tool number 3 is to practice deep belly breathing. And so this is important because when anxiety starts to take over and your mind, again, is going into the future, predicting worst case scenarios, that can put you into more of a fight or flight. And what you want to do is practice deep breathing to help circulate oxygen in your body. And circulating that oxygen helps, again, slow your heart rate, calms you down, and it puts you into your prefrontal cortex, or that logical decision-making part of your brain. This tool can be really helpful if you find it hard to even use the other tools that we talked about because you feel like you are getting very overwhelmed and very worked up, and it's hard to do a 5, 4, 3, 2, 1 mindfulness, or it's hard to remind yourself of what you know to be true, you might be in that fight or flight stage, and sitting down and doing some deep belly breathing can really help you to get back to that logical thinking part of your brain. And again, it can put you in a good place to where you can use those other 2 coping skills. So the way that you practice deep belly breathing is you put one hand on your chest, one hand on your belly. And I like to do this so you can kind of monitor your upper body. But when you breathe in, you can pull that air into your nose. Your belly should inflate. And then you can hold it for a couple seconds and push that air out. Your belly should go in or contract. And so it's important that this hand stay here so you can monitor if you're breathing up here in your chest. I think it can feel normal for some people to breathe up here. You want to try to keep your chest as still as possible, because this breathing in your chest, you see that and you hear that? That's for hyperventilative breathing, and that can make you feel worse and not better. So again, you want to keep your upper body and your chest as still as possible. So breathing in for 4 or 5 seconds, holding it for a couple seconds, and then breathing out for 5 or 6 seconds. And so again, it doesn't have to be an exact science. Do your best with it. It doesn't have to be perfect. I will say, in order for deep breathing to be effective, you need to practice it while you're not anxious. And so you need to practice it in a time where you are more calm. That way, when you do feel anxiety coming on, you can just go right into your deep breathing versus trying to learn it when you need it. So practice this. You can wake up in the morning. You can set a timer for like a few minutes. That practice can help you when you may get that email for your appointment reminder, or something may remind you that your scan is coming up. Don't worry if you didn't take notes during this video, or if you feel like, okay, this is a lot to remember. I do have a managing scan anxiety guide. It's a free guide. I put the link in the description below. So feel free to download that and take it and save it to your phone and pull those tools up whenever you need. I'm sending you lots of encouragement as you continue to navigate life after cancer. And if this video was helpful for you, please like, subscribe, and share it with someone who might need it today. Take care.